discuss about three different topics: network, authorization, and capitation. Now, before we get into this topic, you need to understand one thing very clearly. Whenever we say a patient's insurance policy, we are actually referring to the type of insurance plan under that policy. Now, to understand it in a better way, let us take the example of LIC, which is Life Insurance Corporation. When a person says that he has an LIC policy, what he actually means to say is that he either has a Jeevan Bima plan or a Jeevan Aadhar plan, which are both offered under the same LIC policy. In a similar way, insurance companies in US offer different types of plans under their insurance policies. Now, this is done in order to cater to all categories of people in the society. Now, the plan 1 is a costly plan which is for rich people, and plan 2 is a cheaper plan for middle class people. What are the advantages of plan 1 and disadvantages of plan 2? We will discuss about that in the later sessions. Now, coming back to network. It is the group of doctors, hospitals, and other healthcare providers that insurance companies contract with to provide medical services at discounted rates. Now, this can either be an individual provider or a group provider who is contracted with the insurance company. Now, whoever is contracted with the insurance company is considered as in-network, and whoever is not contracted is considered as out-of-network. As explained earlier, when we use the terms in-network and out-of-network, these terms refer specifically to the insurance plan of the patient. Now, let us go back and apply the LIC example to the provider. When we say the provider is in network with LIC policy, he may be in network with Jeevan Bima plan and not with Jeevan Aadhar plan. Okay. Hope you are clear about the network concept. So always make sure to check if the provider is in network or out of network with the patient's insurance plan, even though the doctor is in network with the insurance policy. Now, patients will generally pay less for services received from in-network providers. Now, this is because the consultation charges are as per the contracted fee of the insurance company. Doctors accept the negotiated fee or contracted fee in exchange for insurance companies sending more patients to their practice or clinic. On the other hand, patients will generally pay more for services received from an out-of-network provider. Now, this is because the consultation charges are as per the doctor and are not subject to any contracted fee. In-network providers are also known as participating providers, and out-of-network providers are known as non-participating providers. Now, the next concept is authorization. This term refers to when a patient's health insurance plan requires an approval from the insurance company before the patient can receive certain healthcare services. Usually, procedures which are of high dollar value require authorization. things like CT scan. Now there are three types of authorizations. The first one is prior authorization. As the name itself suggests, providers are required to take approval or permission from the insurance company before rendering certain services or procedures. Now, the doctor's office can request for authorization either by calling the insurance company or by answering the questionnaire in the insurance web portal. Now, the questionnaire is a set of questions related to the patient's medical condition relevant to the procedure being performed, and if it meets medical necessity, authorization number will be provided on the web portal itself. Say for suppose the authorization request is for a cardiac related condition. Then the questionnaire will be about the patient's heart condition. Things like, does the patient smoke? Does the patient have shortness of breath, etc. But if it does not meet medical necessity, the doctor's office needs to get in touch with the authorization department and speak with a nurse or a doctor who works on behalf of the insurance company and explain them the reason why the test or procedure is being performed on the patient. If it is approved, they will provide the doctor's office with an authorization number which should be mentioned on the claim form. And if it is not approved, insurance company will not pay for that service or procedure. Now the second one is referral. The process of a provider referring or directing the patient to another provider is called as referral. As we discussed in the earlier sessions, the PCP is going to do the initial evaluation of the patient's medical condition, and if further treatment is needed, the PCP is going to forward the patient to a specialist. Now, in this case, the patient is complaining of chest pain. Hence, the PCP will refer the patient to a cardiologist who is specialized in heart-related problems. While referring the patient, the PCP office is going to provide the patient with a paper referral form. Nowadays, instead of paper referral form, the referral information is directly forwarded to the specialist office by the PCP office via email, fax, or through EHR, which is electronic health records. Now, the specialist office must mention the PCP information while submitting claims, the patient claims to the insurance company. Without referral information, the claim will be denied. Now, the third one is retro authorization. If the provider fails to get a prior authorization due to some unavoidable circumstances, the provider's office can render the service and later on request authorization from the insurance company within 72 hours duration by explaining the reason why prior authorization was not taken. Now, like all other offices, insurance companies also work from 9 a.m. to 5 p.m. After 5 p.m., authorization department will not be available. Now, say for suppose a patient walks into the doctor's office with a complaint of chest pain at around 5:10 in the evening. Now, this will be considered as an emergency and the doctor may need to perform certain tests on the patient. things like EKG and 2D echo. Now the EKG is a $150 procedure and may not require authorization. But if the provider is planning to perform a 2D echo, which is an $800 procedure, it will require authorization. Now, at this point of time, prior authorization is not possible as the insurance company is already closed. And let us assume that the patient came to the doctor's office on a Friday and Monday is a holiday because of long weekend. In this case, the doctor's office will perform the 2D echo and update the insurance company about the procedure on Tuesday. Now, this is the reason why retro authorization has a time frame of 72 hours. Now, coming to the next topic, which is capitation. Providers in US are paid in 3 different ways. The first one is fee for service, the second one is capitation, and the third one is salary based. We have already discussed about fee for service and salary based employment in the earlier classes. Now, the fee for service, capitation, it is a payment agreement for healthcare service providers such as physicians or nurse practitioners. It pays a physician or a group of physicians a set amount for each enrolled person assigned to them per period of time, whether or not that person seeks medical care. The insurance company enters into an agreement with an organization to provide insurance coverage to its employees. Now, these employees are considered as group or panel of patients, and the insurance company is going to assign this panel of patients to a particular doctor, like a PCP. Now, this PCP will be responsible for all primary care services like office visits, basic tests, follow-up visits, etc. Now, the payments are based on per member per month. Now, let us take an example. An insurance company assigns 100 patients to a provider and has agreed to pay $50 per month per patient under capitation. Now, if you do the calculation, the doctor will receive a payment of $5,000, which is 100 into 50, regardless of the number of patients that may seek medical treatment. Now, fee for service payment structure is very common in US, and most doctors prefer this as it is incentive based. The more number of services provided to the patient, the more will be the reimbursement for the provider. On the other hand, when it comes to capitation, it is declining because it is not incentive based. Regardless of the number of services the doctor provides to the patient, he is going to get paid a fixed amount per that patient per month.